Yeah, sure. Thanks for having me here. My name is Fiona Zhu. I'm currently the Senior VP for AI integrations at Lumexa Imaging. So a bit about Lumexa Imaging. We're the second largest outpatient imaging company in the country. We currently operate about 185 outpatient imaging across image centers across 13 states, and we cover 485 hospital partners across the country. Have seven JV partnerships with major healthcare systems in the country. We have about 400 radiologists and APPs that are our own employees, and we also contract with 600 plus radiologists across the country to read for our volume. So it's at my current role, I oversee the AI strategy across the company, as well as coordinate all the efforts, as you could imagine, from both IT front as well as clinical operational front across in the company. Before Lumexa, I spent a couple of years in both the provider side as well as the payer side and held roles in finance, revenue cycle, corporate strategy, but with a focus more on analytics and process improvement. So all of that's coming back to help me think through the AI integrations in my current company. Sas, over to you.
Hi everyone. I'm Sat Datla, currently serving as a architect leadership role at Cottage. We are a specialty hospital in the Central California coast. We have three different hospitals. One is at Santa Barbara, one is at Goleta, and also Santa Ynez Valley. We are recently awarded as a level one care operations center, one of the high care hospital. We focus on a lot of clinical operations in the different verticals. My role is to basically bring the AI leadership, AI governance into the hospital network, mostly focused on six different pillars, right? Clinical optimization, care optimization, any kind of departmental level of enablement of AI, and also employee enablement of AI. So I think my day-to-day focus is understanding the landscape of AI innovations, what kind of tools out there, how do we enable our entire hospital powering with AI. Previously, I was helping with a couple of healthcare service providers and insurance providers and life science companies. Basically, my focus will be always advising into CIO, CTOs level and AI innovations. So glad to be here.
Yep, thanks, Seth. And my name is Alex Sushko. I'm a solutions engineer at Glean. What that means is that I work with a lot of our customers kind of at the user level, at the department level, to understand workflows, systems, processes, KPIs, and then marry that back to a technology stack that really makes sense. So integrating anything that you have currently in-house, mapping that to a requirement, and then outlining and implementing a solution. Before Glean, I spent 4 years at an RPA company called UiPath, where I specialized in healthcare and life sciences, mainly on the provider and payer side. I worked with customers such as HCA, Kaiser, UPMC, NYU Langone, Cigna, United, and many others. My primary responsibilities were to build out AI use cases across revenue cycle management, think about prior authorizations, denials, appeals, reading claims forms, inputting them into different systems, working with SharePoint, Teams, EMRs, various types. We all know how many enterprise applications that we have. So my primary job was to essentially link all of those systems together to complete and automate a use case. The challenges that we ran into were obviously working with legacy systems, internal political battles over who does what in terms of EMRs and different types of AI technologies in-house. And with my experience there for 4 years, I realized that the number one challenge is not necessarily automating workflows, but solving for that five rights challenge, delivering the right information to the right channel at the right time to the right person and in the correct format. This actually is what brought me to Glean, which provides a horizontal and unified knowledge discovery platform that's backed by AI and ML that surfaces the right information to the right person or to the right AI agent in a permissions aware way. So we're very excited to have you here today, and we'll get started with the webinar. So the first item on the agenda is understanding the challenges of operational AI and making it real within the organization. I read today on Fortune magazine that almost 70% of all AI pilots actually get decommissioned. And we all have a story from either our current experience or maybe our past experiences where we tried to implement AI and ran into significant roadblocks, despite the fact that it might have looked promising at the outset. So I'll turn it over to Fiona and Seth here to maybe talk about one or two stories that you guys have from your previous experience.
Sure. I'll start. I say in my current role, we get approached. I totally understand what you're saying, Alex. We get approached by people in the field selling us all the fancy tools that are out there, in the field, going to solve all the problems on day one. But many times I find myself going back to the basic conversations with our business owners and our operational owners, which is how do we solve for the very basic thing? It may not be just it might not be in my current organization. I've seen other peer organizations, I've seen in places I've been before, that is just getting the patients the right care they need at the right time. The very basic thing of patient access. That has been, as far as I know, I've been in this industry, the very fundamental challenge a lot of organizations, whether payroll provider, is facing. And I don't think I don't know many organizations have figured it out 100%. They might get better over time, but it's just daily challenge of going to it. When I speak to, especially the frontline workers or the center managers, when I speak to them, what's their worry when I go, what's the number one thing they're trying to solve working to go into the day? It's about filling, look at their schedule, making sure that patients are coming in. And what happens if someone doesn't show? What's going to trigger the next step? And all of a sudden, you have your providers, waiting, and you have the staff on site not able to see the patient. And how are you gonna, are you able to give it to the next patient in line? And if so, are you able to do it in a timely fashion? What other, last minute things you have to change to your room preparation to make it happen? And let alone the patient that did not get the care on the day, what's going to happen to their care going forward, and what's the follow-up plan? It's a whole lot of things that go into it to make that patient access a seemingly easy words, but it's a challenge that we know that face a lot of organizations in the country in healthcare. And many times it's not about getting the fancy tools put on top, but really tapping into the integrations with your existing systems, with your IT, with operational workflows, as well as your clinical workflows. Everything has to come together to make it right. So I mean, it's not like one example, but it's just something that I always walk away with when I end up talking, talking to the leaders in the organizations. A lot of it goes back to the fundamentals. How do we solve for the basics? How can we even leverage something advanced as AI if we don't have the basics figured out to put something on top? So I think that's a lot of times in my work takeaway.
Yeah, that's very interesting. And with patient access, how did that come up as an area of focus initially for you? What line is it drawn to strategic initiatives that maybe your organization had at that time?
I think that is also a challenge in and of itself because it touches so many points. So you always have to coordinate to so many parts that go into it. There's not a single owner of the function. It's not one where you can go to one business owner and be able to figure it out. You really have to pull everything together. The fundamental, the IT systems, the operational systems, your staff managers and your clinicians, they're everything. And in some cases, like the hospitals, the center managers, your facility people as well, everything have to come together for it to happen, which is why it's been so challenging. It's not one problem that IT can solve. It's not one problem that AI can solve. It is really having to really look into integrating the technologies into the workflow. And that's the way we'll get anything like that to work.
Yeah, and a lot of from the front line of working with a lot of these groups and business owners, I noticed that oftentimes there's a directive to, hey, we've got to use AI before we even know what we're going to impact. And then when we figure out that, now we have to talk to all these businesses and groups and getting that information and figuring out what the process looks like and what the correct metrics are. Was it a challenge to form that project team kind of in flight, rather than outlining the project and then going about solving it?
That is a great question. What we are doing in our current company is now we have a dedicated team that I'm leading to really put the hold the court like the efforts across the company. There's so many efforts that are happening even before this team existed. Together is to reframe it in a way that we're not using AI for the sake of there's a shiny new tool out there. We have to figure out a way to use it. Instead, it should be turned around. What is the problem we're trying to solve here? Let's identify the problem statement first. Let's figure out what we're trying to achieve. Let's figure out what has to come together for it to happen. Figure out the measurement of success, the KPIs, what we're trying to solve for, and then we can get the right RACI together, the right stakeholders together, and then we look for a solution. So the solution is always the solution comes later in the part of the conversation. The front end of the conversation, a lot of it is around what are we trying to do here and who's going to be responsible, who's going to be, the whole matrix of RACI, who's going to, be part of the conversation to make it happen. Then we're going to solve for the right for, we're going to source the right solution. Some of them might be homegrown, some of them might be, sourced elsewhere, but it has to be driven by a legit business need, and there has to be solid conversations with the right people at the table to figure out how we're gonna get there. Technology is, I keep saying technology is a how, it's not a what. We're not trying to do AI for the sake of AI. AI is just one way for us to get there, but we have to find out what we're trying to go first.
Yeah, absolutely. And one thing too that I've noticed, AI and generative AI in particular has been amazing for people that are creative. So that means everybody has a lot of ideas now about what to automate, where to introduce AI. So I think one other challenge that I see with my customers is prioritizing which AI initiative goes first. So maybe we'll save that topic for, getting started with AI and maybe taking a look at some frameworks or some heuristics or rules of thumb that we can use to select the right projects. But, I totally hear what you're saying. This is something that I experience with my customers and helping them get past it. Seth, also curious to hear from your side. What has your experience been?
Those are great points, Fiona. I completely echo those some of the things you mentioned. I think what I see from my perspective is AI is often ready before the organization is, right? So it's not just the tech; it's the entire ecosystem. What makes the AI is successful. So if you talk about more challenges on the operational AI, right? It's more into we operational AI heavily depends on your human in the loop process, right? Unlike clinical AI often gets a green light under more formalized regulatory process, but is operational AI is day to day what we do, right, with the human in the loop process, right? So I think it's more in the scheduling, it's discharging planning, all those things depends heavily on the human in the loop process where we need to be very methodical how we operationalize that AI, right? And also, mostly organizations often run pilots with no clear path to scale. This is another issue I see where solutions are trailed in a very small, controlled environments that don't scale up in a real world operations, right? They don't actually showcase the messy world in your operations, right? Operations is not a very smooth ride, right? So I think that's the biggest challenge I see, and then a lot of pushback, right? The culturally, I think organizations are not aligned end to end to impose those kind of innovative way of it's a new ways of doing. Let's be open mind and bring those collaborative, engaging aspects of AI, which is really the culture of the company rather than the actual tech, right? I think Fiona mentioned a couple of points which I absolutely agree with those. I think mostly you see that like hospitality, like hospital or supply chain, right? AI pilots often fail because the data inconsistencies, incompleteness. There's also talking about discharge planning of AI, right? We really struggle to integrate care coordination tools, leading to more underused kind of AI, right? So how do we augment that staff in a more cultural way? Hey, we are bringing new ways of doing things with an AI. Let's train them culturally, operationally them. And then when we thinking about use cases, right? Let's not just think about a pilot use case. Think about pick a real hard problem in the operational AI and understand before even doing what is the outcome. Okay, if we replacing AI with the regular operational processes or workflows, what's the outcome we actually want to get out of it, right? I think that clarity of purpose is very important. I think that's where the most of the struggle.
Oh, those are very good points, and I'm saving some of them down to ask you about it later. Mostly around how we view and frame human in the loop. Depending on what technology you're using, human in the loop activities can be value add, or they can be duct tape for a solution that's not well integrated, not well planned, right? So it would be nice to hear from your experience too, knowing where is the high value input of human in the loop versus we're using human in the loop to continuously check something that's error prone. So maybe that's what we'll get to on the getting started with AI.
Sure.
So let's use this section here to discuss some of the use cases. How do we get off the ground? What has made an impact, and maybe what remains still out of reach? And if we also have for the audience here a question that we'd like to pose to the group, so if you can participate in this poll, it'll give us a good idea of where everybody stands and will help us tailor the conversation more actively. So maybe we can start off with some of the ways that you get started with AI, going back to a point I made earlier about prioritization when there are conflicting use cases or conflicting strategic priorities. How do you measure what's going to be the most impactful within AI?
Yeah, I think measurement is mostly I would guide it into three principles, right? Um, what is the operational efficiencies you're getting as an organization? What is the workflow refinements you are trying to navigate through? And the most important part is the impact, right? What impact you're enabling in that process, right? As an operational within the organization, like hospital like us, right? We are very operational heavy, right? So every time we bring a new use case, we ask these fundamental questions. Okay, where is the value chain in that process, right? So that means before even we implementing the AI use cases, there's a lot of groundwork we need to do internally, how we measure that outcome, what baseline metrics versus once we deploy the AI use cases, how we are measuring with the baseline, right? Most of the organizations is not even ready to understand without AI, how we are measuring our productivity or operational efficiencies, right? And how do we correlate once you deploy a tool? And then how do we enable that correlation? Okay, here's the percentage gains in terms of productivity. Here's the percentage gains in terms of cost savings or operational metrics. I think those are the ones is I would recommend.
Yeah, and Fiona, when you got started with AI at your organization, which areas were you able to first get into production at scale? This is something that we hear from a lot of customers, and Seth, to your point, people start with narrow focus, as they should in healthcare, to make sure that things are safe, patient outcomes are still preserved or enhanced. However, when you start small, sometimes you end small. So, how did you pick the right use cases that you were able to actually get measurable results from?
I think going back to what I was saying, that is first we're trying to identify what we're trying to solve for here, right? So what's the problem statement? And then from there, it's more getting to see all the things that have to come together for AI to be any effective. And it comes with Seth, you mentioned great things, how do you measure the essentially the impact of it, other things that all have to be packaged together for any business, any use case to be reviewed by the team and by the leadership to drive it forward. But what I saw was that coming down to it, it's where you will get the most expanded adoption of AI is where it's sitting on standardized data, standardized platform, standardized workflow. It has to be, you got to have at least two out of those three for anything to be scalable. And then the other one you might solve for throughout the process. But with that kind of lens, even though we might start with something small, we know that this is a small pocket we're testing. We want to see early results, but we know if it checks off, of course it comes with it has the success criteria. If we checked off the boxes, then we will be good to go and expand it. And it will be
Mhm.
expanded on the same platform. It will be expanded on the same, workflow, and hopefully it will be sitting on the same data system. So that part has been we didn't really quantify it, but it's one of the check boxes that we're reviewing at the pilot priority review process. Is it
Mhm.
sitting on the enterprise standard format where we could easily scale if it comes to a yes, the pilot works out. So I think
Yeah.
that's the groundwork you pretty much have to do before you start any AI pilot is to put in a we all hope AI pilots work, but as Alex just said, I mean 75% I've heard number 80% of them don't scale. Well, how do we try to minimize that number and try to maximize the number that we do scale? And that is to do the groundwork and see if it doesn't even have the right environment for you to scale.
Yeah, right. And it almost feels like you're a VC fund investing into these pilots, and you need a few of them to hit big, but you need to experiment to learn and understand what the capabilities are. So to
Right.
that end, can you talk about something for the audience that was successful, that like a specific use case, if you're able to divulge some information around it?
Yeah, sure. I mean, maybe just to frame a little bit, how we think about AI at Lumixa, there is the part that, as you mentioned, the clinical front, that is really more affecting our physicians' workflow. But I think for the second part, the operational AI, that's probably more speaking to the audience of today's webinar more, is the part that could have the operational implications to our center staff, our hospital partners, and then it could be the operations that sitting in the back office or the administrative part of the healthcare process. So that is where I think actually the second part of radiology is very developed in the clinical AI front, but the operational side of things has a lot of potential as well, because when it's not as strictly scrutinized by the FDA, so there's a lot of development in the space, a lot of choices to pick from. And second, it's where I think most of it is actually sitting on, at least where we are, is sitting on somewhat of a standard platform. For instance, in the revenue cycle space, we've decentralized all of the revenue cycle management for our company. So there is one platform that we could and try something out and deploy it, potentially scale across the company. And that is probably no surprise that we see a lot of development or adoption of AI in our company as well. Like I mentioned, there's a lot of things we could source externally, but we looked at some that our platform vendor had a platform system had partnered with, and started with something small, and they tested it out. It was more on the in the space of the AI agents that we were able to first test out the inbound function, and then now testing out the outbound function. And we know if it checks off, that could be easily scaled across our system. So that's probably one of the examples I can think of that are very operational driven, and I think for probably will apply to a lot of organizations where they have centralized administrative functions.
Yeah, absolutely. And Saf, can you speak about a certain experience or maybe some high level areas? Maybe no need to go deeply into any of these use cases, but maybe discuss some areas where you've had success with AI and just a quick blurb about those use cases.
Yeah, certainly. I think our approach is let's first start experimenting with small, low risk, high friction areas of use cases, right? Where we can test the feasibility without disrupting any of your workflows, right? And then collaborated with the both tech and operational teams in the AI capabilities, right? So I think most of our use cases, we ask this fundamental question on where is the real pain points as a hospital? where are the real burnouts for our staff, for clinicians. And those are the areas where the real empowerment we want to start with. We start with the people in the workflow, how the interaction with the systems, right? I think one of the things is we started looking into is how can we reduce the wait times? How can we give the more pajama time to clinicians and nurses, right? And also we started looking into radiology efficiencies, how we optimize that, right? So these are the areas where we think is the most high impact, high friction with the low risk, right? Because this approach does very immediately you can see the impact how the people are feeling, because in the current worlds, right, most of the frustration is people has to wait for a long time to see the AI benefits, right? So it's a long churn. There's a lot of cultural setbacks, and you need a lot of support internally, right? So that's why we choose a low risk high friction where the use cases can be immediately empower in the operational of that, right? The humans when you are currently in the process, right? So, and also we're looking into areas where general sense today, most of the people go to Chat GPT and all these frontier models, right? Mostly they use for day-to-day, grammatical structures or context structures like that, right? So how can we bring that simple use cases where our employees and partners and the clinician and the people who are working in those hospitals can immediately leverage, right? Sometimes they write a summary, but they have to literally manually write those summaries. Can we use AI assistant approach for them to as an assistant tool for summarizing it and then supporting the context wise and automatically send some messages? Those kind of AIs we really want to empower to start with, because that's the stage one we are in. Then there is a stage two, stage three. We're still exploring to see where that mapped into, because as a methodical approach rather than, okay, this is really cool, magical, let's go with that. I think that approach is not going to play in the long term strategy very well.
Yeah, that makes sense, and I think that kind of transition us well to the next part of the presentation, and it's about handling data silos. We know that the EMR was supposed to be that one solution that fixed these data silos and operational challenges of moving information from one application to the next and have that unified experience. When you move beyond just a simple one question, one answer assistant or AI type solution, and you need to integrate with multiple systems of record to create a unified response or to pull that information and make the right decision within a clinical decision support model, for instance. How are you doing that today with the proliferation of all these apps?
It's a great question. So I think one of the ways, like, I mean, in most of the hospital or life sciences or clinical data is it's not clean. It's very inconsistent, incomplete, unstructured. Some ways it's structured, but we really don't know where the data is actually harmonized, right? So I think the approach here is to first look into the data before even look into the data use cases. Is the data can power those use cases? Is the data is operational? It's not clinical, that's a problem, right? So the clinical data is usually more structured and standardized via EHRs and codes and all this stuff, right? But on the operational side, your supply usage, staff actions, and scheduling, this is all fragmented. It's manual, it's not even logged, right? So for us to build a model which is easy, which is feeding the reliable, continuous operational data is really important, right? So that's where we need to understand, let's be very methodical. Where is your art data is stored, structured, operationalized, how clean, how supportive it is to your use case, right? In that exploration itself, we need to understand, is any efficiencies you need to be ready with before you even do AI, right? These efficiencies can be, okay, let's ingest all this data in a way which is your models can consume right away, right? So that level of data audit, data governance, data compliance, and also make sure we're dealing with a lot of sensitive data in this space, right? And we have to make sure the privacy and compliance, which is where most of our focus is, to make sure we are not sharing any data into the frontier models when the data is actually into feed into the models, right? So these kind of preparations are very important, and that kind of a methodical approach is what enables us to be successful in the AI.
Yeah, and Fiona, what about from your perspective? I know radiology actually has their own systems, own versions of EMRs and tools that integrate with maybe the foundational EMRs like Epic or Cerner. How do you navigate that interoperability challenge between either other providers or insurance payers? Just if you could set the landscape for that, that might be interesting for the folks on the call.
Yeah, absolutely. I think that's a great question, and it's a great point. It's definitely a challenge for radiology. We're purely radiology company, right? So we rely on a lot of our services are referred and by other providers outside of our organization. So we may have a central system internally for ourselves, but on a day-to-day basis, there's so much data that's coming from externally, and we have no say in those referrals providers, which system they use, what kind of fields they're putting, and so on and so forth. So I think just getting the data in a standardized format and getting it go through our standards data flow, that is a constant challenge that we have to combat in the industry. That's the nature of the industry. So like what Sasha said, I totally agree with a lot of the points you mentioned. You really have to lean into your data governance structure, your data team, a lot of operational and clinical expertise in it as well to really map out where the data is coming from and where it's going, where it's flowing through the internal system, and where it's going back out to external providers who refer to us. So, for instance, in radiology, a lot of our data gets transferred between organizations through HL7 messages. So it carries the basics, the patients, what they're for, and those that type of thing. So we, not just for AI, but for any other project we do, that is one critical part. We have to map out where it's coming from, what kind of information is going into it, and we have a template, like standards in a template internally to manage that, to store it. At least even though we deal with all sorts of format of data out there, but once we collate it internally, this is where the data repository sits, and this is the format it's going to follow. And those are fields that we're trying to standardize as much as possible, and then really form a standardized workflow for the flow of data to go through the various applications, like I said, on top of our workflows. Radiology is one where it's so technology driven that enables like anything we do has to be enabled by technology, and the data flow across the systems. It's just so important, so critically important for anything to be successful in our organization.
Yeah, and it sounds expensive managing all of that operationally and from a technology perspective. I can speak for myself working at Glean and having to work with system integrators like PwC before, as well as gluing together solutions through RPA. Is that it's not an easy challenge to solve. From the customers that we work with at Glean, having that unified knowledge layer that where's the single source of truth for the enterprise context that you have, such as your documents, any referrals, patient information, maybe redacted PHI for some of them. But having that one unified layer, we see is an enabler for scale, especially in heavily regulated industries. However, what I'm trying to also understand, and maybe some of the folks on the call too, is that the EMR and all the modules around the EMR kind of live in their own world. Is there room to, and how much room is there maybe to automate and gain operational efficiencies and improve patient throughput by automating certain things outside of purely EMR driven workflows? Have you identified any needs like that, or what does that look like today?
Yeah, I can go with that. I think there's a lot of EMR integrations, or most of the hospitals, right? Like Epic, that's what we live in and day out, right? So I think our strategy is to first to see how we can enable AI and EMR related Epic or any other internal tools related solution enablement, right? So I think some of the things we are looking into in understanding, okay, this is where most of our operation flow is around Epic, around EMRs, right? If that is a case, what are the workflows in those tools, in those enablement of the tool integrations? What is the operational efficiencies, right? So one or two comes on the top in those lines. So one of the first one is we have to think about is, okay, if you are integrating EMR, any kind of a risk assessment, right? Predicting, okay, is a specific disease risk or a specific before it's even happening, right? Predicting and prescribing that, right? So those are the one of the things we're looking into. Also, the next level is within the documentation, right? There's so much documentation in the Epic and EMRs and right, but that documentation, there's so much Gen AI you can embed in that, right?
Mhm.
That way you can have a clinical documentation use cases can be, because most of the people interact with these tools. There's a lot of documentation after the shift. They spend a lot of time to refining those documents, revising those documents, making corrections, codes, right? That's why clinical documentation is a very important aspect of that, where we can optimize a lot of that flow within those tool set, right? I think those are the two, I think.
Yeah, that makes sense. One other thing on this is that how many knowledge systems do you think you have within Cottage Health where important and critical information lives? And if you can put it in terabytes, how many documents do you think you have all across all of the provider networks and all of the systems?
I think some hospitals are just they primarily focus on care, right? But we're also a research hospital. We do a lot of research, right? We
Right.
partner with a lot of universities and other corporations, right? So I think I don't have the exact number, but I think close to, I would say, terabytes.
Yeah, that's what we see too, right? It's kind of spread across everywhere. And do you think it's like 12, 24, 36 different enterprise apps, or is it even more than that?
I would say somewhere between 20 to 30.
Yeah, yeah. So that's always a fun challenge to stitch that together and kind of navigate through those workflows and get the ROI that you're expecting. So speaking of which, kind of brings us here to the last topic, and maybe we want to launch one more poll for the audience here. So if you go to your polls tab, feel free to vote right here. Also, if you want to check out the doc side, you'll see a button right next to poll. It'll lead you to the Glean Healthcare white paper, where it actually addresses a lot of the questions that I see in the chat today. But speaking of ROI, this is my favorite topic because this is what actually gets solutions into place and scale. We've all been in those limited pilots. Hey, let's see if this technology works for 5% of the use cases or 5% of the volume. It's a great success. And then when we scale it to 5 million, it falls apart, right? So, and that's because maybe we didn't look back and see, are we solving the right problem? And who or what is going to sponsor this basic project that we have. So I like to get away from just time savings alone, because I feel like all productivity tools are led to time savings, which is important. But more importantly, the question that I get asked from executives is, if my nurse gets 1 hour back, what is she going to do with that time? Or what is he going to do with that time? How do you link ROI to something more high level, more high value to the strategic leadership of a hospital organization, for instance, rather than just saying time saved, or I've got a couple minutes back here, I got an hour back there?
Yeah, I think I absolutely agree that time saving alone is not enough, right? And AI is no longer an experimental stage. It's becoming a very strategic investment, right? So that's why ROI matters exclusively at the leadership level. All the CFOs, CMOs, CEOs wants to be tangible outcomes, right? Without ROI, you're not able to measure and propel. All the pilots going to stall, your funding dries up, right? So we don't want to be there. So I think there is a specific measurements, a dimensionality people can follow. I would say rather than just focusing on time, focus on operational efficiency, which is reduction in manual task. How do we approach faster discharge? I think one of the use case I mentioned earlier is radiology, right? It's a very high risk, but there are some low risk use cases where wait time reduction, incredibly valuable, right? Which is a faster discharge, reduced rework, right? That's on the operational efficiency. And the quality and compliance is another important aspect where we improve documentation. I think clinical documentation is the most important use case in my perspective, because it can give a lot of quality documentation and feedback, fewer errors, audit readiness, right? And also the staff experience. I think, Alex, you mentioned that, right? If we
Mhm.
can reduce the burnout, right? The tech satisfaction, the interaction of that tool for the clinicians or the staff, it becomes more ubiquitous, right? They're able
Mhm.
to quickly integrate, they're able to refine and revise the list very fast and get off and take another help, maybe give a care to another extra patient, right? That kind of
Mhm.
a staff augmentation is really important. How do we measure that? How do the burnout reduction and the amount of time we are spending without AI, with AI, how much of time they're spending, and
Mhm.
appreciate that the core productivity gains, right? Then the patient outcomes, the last one. This is where the faster care coordination, right? That means how do you hand off from one department to another department so the care will be continuous and the care will be immediate, right? In that care coordination is where most of the AI can accelerate that handoff and then give extreme satisfaction to the patient side of things.
Yeah, and that's where that human in the loop that maybe we talked about in the beginning really comes into play. What can AI do at 99 or 98% accuracy, but then the human in the loop component comes in and really completes that value loop that ultimately leads to better patient outcomes. And that's one thing I also see in AI implementation is I don't want to call it fear, but the acknowledgement that AI is wrong sometimes, right? And that it's not going to be 100% accurate. And I've seen that people just shut down the pilots because they're not going to get 100% level accuracy, right? Well, people aren't 100% accurate either. So, how do you justify like which steps in a process are okay to have a certain error rate and which steps are not? I'm assuming it's going to be mostly on the patient care or adverse events side. But I've also seen from a lot of hospitals, large networks, where their class action lawsuits and their legal bills are stacking up because of patient safety outcomes. So that's before AI. So I'm wondering, how do you balance the risk of operationalizing AI within I would say patient facing work versus de-risking and handing it off to a human?
Yeah, it's a great question, Alex. I think there are some areas on the patient side you can actually enable it very fast with an AI. Not all the areas. I would not go into sensitive care areas, but the communication side. Okay. When patients are come to the hospital, everyone is not looking for just for the care. They're looking for a lot of questions, a lot of comfort, a lot of quality, right? So are they getting their food on time? Are they getting the best nutrition? Those are the areas, right, which is not high risk, but you can actually augment quite a bit, right? But I think in the measurability of the ROI, you can never hand off 100% of your workflows to the AI. As you
Mm-hmm.
said, you're not perfect. AI is not perfect, right? So one of the things I would suggest to as a guidance in this area is see wherever the AIs can empower on the patient side, but always there is an end human in the loop process to validate and check and then transcribe, right? Or transfer that handoff, right? So if you can follow that ethical, more in the compliance, more in the explainability of AI, where the human in the loop has to be there. We
Right.
can never hand off and take that part and to give it to the AI, right? So I think these are the guidelines we kind of as a culture we want to incorporate right from the beginning of adoption of the AI, right? So uh, let us take if when a nurse is leaving her shift and she saw something in her notes or something which is not right, let's not send it, right? So put the sensitivity labels. Even if you're creating a AI for sensitive areas, they should be something visually, okay, please, this is generated by AI, pay attention, make use it with caution, right? Rather than just, oh, it's AI is given, let's go ahead with it, right? So that's where the human in the loop, and the last part of that is always has to be human in the loop.
Yeah,
Yeah.
no, I definitely understand that, especially towards patient care questions. And Fiona, what's been your experience on this, and what are your thoughts on kind of delivering the right ROI to the right people within the organization?
Yeah, I would just add, I mean, since my thought was there as Das was talking, I 100% agree that there is not one thing that we can completely hand over to AI and not have human touching the loop, right? Like healthcare is it's a field with such low tolerance for error. So Alex, you're right that human is not right 100%. AI is not right 100%, but the hope is that with human and AI together, we're going to strive for and as close to 100% right as much as possible, just because the industry we're in, healthcare, there's really no tolerance for error. Like anything that, like error in the healthcare space has significant impact to the patient's health and health. That is just something that we'll always striving for as higher accuracy as possible. So that's I think it's about setting for any AI pilot or any project to go into the pilot phase is about setting the expectation right. What are we trying to use the AI for here? And then have that period, establish some kind of period where we're going to have very heavy, actually probably more heavy human interaction in the process than before, because you're going to learn how to work with AI. The human you have to train the humans to see the spot if AI works, if it not, like if anything we can, try to fine tune to make it work better. The initial adoption phase of the AI project, you're not going to see, probably not going to see efficiency gain right out the gate. It's going to be more of a learning curve for both the AI model and the humans to work well together. So, I think again, the intent is always have that hand in hand work together. It's kind of funny that in the radiology space, many years ago when AI started coming out, there were predictions that AI was going to replace radiologists in 5 years time. I think that came from one of the Nobel Prize winners a couple of years ago. And guess what? 5 years later, radiologists still here, strong, and there's a lot of adoption in AI in radiology space. So now the new thing is that in the future, the radiologists who use AI will replace the radiologists who don't use AI. So that kind of speaks to how humans and technology have to work together.
Yeah, and that's a really good point too. What from my experience too is, and this is my favorite topic of AI as I keep getting deeper and deeper into this year after year, is HCI, human computer interface. So let's say you've done the hard part, you've prioritized your AI use case, you figured out which one to build, you have the project team, the stakeholders have signed off, the ROI is right, you implement it in production, and nobody uses it or nobody leverages the solution, right? So there, all of that projected ROI is still zero. You might have had the best solution in the world, but no adoption. And this is what we see with a lot of these baked in AI tools. Everybody that wasn't a Gen AI company that now became one overnight, there's that kind of going back to a little bit to that data silo problem, is that we have all of these pockets of AI with different interfaces, different AI models behind the scenes, with different expectations of inputs and outputs. So one of the key areas I think that even Glean addresses is being that user interface for AI. We know that providers didn't go to medical school to learn how to do Epic or how to be professional Epic coders or interact with 100 different applications. Nobody went to school to do that. So I think one of those things too is understanding the user experience, the user interface, and making AI usable and accessible to people without having them to learn a completely different skill set or having to learn a completely different application every couple of months. What are your thoughts around that?
I think that's another, great question. Our intent, I mean, I think for any AI project to be successful, it has to be embedded into your existing workflows. as much as possible. I think we kind of talk about a little bit here and there. Sas mentioned it before as well. Is to integrate embed into your existing workflows. So it's exactly to your point. There's so much development out there in AI. There's a new, I'm not even exaggerating. There is all. I looked at the FDA approved radiologist AI list that they just published recently. And for the 5 months in 2025 so far, there are like 115, if I get the number right, new radiology AI algorithms are being approved. So 5 months, you think about it, it's not exaggeration to say that we're getting one approval, one per workday, if not more. So that's the kind of disruption that's like the speed of development in the market out there. You just cannot afford to have your workforce, be it clinician or staff members, to go through that kind of transition and changes so often to try to keep up. So that's why, I mean, I think a lot of it comes back to having the right expertise and knowledge internally to kind of keep up what's going on there. And then again, driving back to the basics, what are we trying to solve here? Let's not get pushed because of the development out there, but let's try to find out try to identify what is the root cause, and the problem statement to the root cause, and to try to solve it, try to solve for it based on what we need instead of being, pushed. So again, I think that a lot of it is still going back to the basics. What are we trying to do with AI? And then figure out the best way to stay agile, but also flexible, be able to test quickly through a pilot, and if it works, and scale it, and also have essentially a backup plan. If it doesn't work, what are we going to do? That's something we got to think about even at the beginning of the AI pilot, right? What's the expectation? If it works, what's going to happen? If it doesn't, what's our backup option? So those are the right kind of conversations to have to stay, to have that flexibility to keep up, but also not, waste a lot of resources internally to pursue things that might not generate any return for you.
Yep, that makes a lot of sense to me. Seth, did you have any closing thoughts on this, or we can open it up to questions?
Yes, I think this is my favorite topic too. I think couple things, right? The AI is the new UI, right? So that's the future we're heading into. So in the future, AI is the all the user interaction, user experience happens, right? So in that integration, we have to think about AI must sit within the workflow, not beside it. So the problem today is, as you stated earlier, Alex, everybody stamps AI company and they change this URL to .com to AI, and immediately they become an AI company, right? That means whatever the tool set they have, capabilities they have, they just stamp AI right next to it somewhere here and there, right? As a flavor, right? That doesn't work, especially in the sensitive areas of healthcare and life sciences. You have to come up with a new ways of simplifying the flow, right? Don't think of AI like, oh, chat GPT, you go offline and then have some queries, get the responses and go back to your tool. It doesn't work that way, right? So you have to think about within the workflow itself, how you can augment AI. I think that's will be the game changer. Whoever can do that integration so seamlessly, so ubiquitous, so synchronized way of handoff, that will be the perfect way for us to have that human computer interaction.
Yeah, couldn't agree more. So we're right at time. We have a few minutes left for questions. I tried to address some of them in the chat during our presentation. If anybody has additional questions now today, we can go ahead and answer them, or I think we can pretty much wrap up here.
Yeah, I do see some questions on the, like, I can see that, was that Krishna Srikumar? Isn't radiology AI more regulated? How is it low risk? Yeah, it's very heavily, highly regulated if you're using into more into uh, the the clinical side of radiology, right? But there's a radiology, there's a lot of operational efficiencies around, right? How do you take the radiology appointments? How do you reduce the time of your increasing that flow, right? Rather than today you're looking into 50 patients, but if you can optimize that flow, how can you increase that to 100 patients, right? So there are some low risk areas where you can target, not focusing on more on the image side of things, but the flow side of radiology can be addressed.
Right, agree. The administrative side of radiology's Glean solution was similar to any other healthcare organizations out there, right? But I agree the clinical side, that's more strictly regulated and it has to be FDA approved for any commercial solution to be used.
Yeah, we saw some use case questions on here as well. There are lots of use cases. I can speak for myself, but to Sat's point, Fiona's point, there's a lot of use cases and operational efficiencies to be mined out of documentation. Information is everywhere, and it's changing. Somebody updates it. It's either deprecated or evolved or edited to something else. And getting that information at the right time to the right person for the right workflow is still difficult. So being able to automate that where people can simply ask questions without, spending hours searching for answers, potentially impact patient throughput or patient safety, is very important. I think it's important to tie that higher order bucket of clinical documentation and then segment it into what specific documents do we want to automate? Where do we see the most benefit, right? For instance, surfacing the right payer policy for the right prior authorization. So anything around knowledge management, knowledge retrieval, and freeing people from having to sift through documents and find that one piece of information or that needle in a haystack, I think is super valuable.
I think the knowledge and the documentation is the very, very super important. And also, you can easily integrate AI in those two areas.
Well, I hate to be the one to end the conversation. It was, a lot of golden nuggets in there. But that brings us to the end of our session. So thank you all in the audience so much for spending the hour with us. A huge thank you to our speakers, of course, just for being so open, about the real challenges and lessons learned when it comes to bringing AI into healthcare operations. Anywhere from navigating data silos to proving ROI. It's really, really clear after today's conversation that there's no one size fits all approach, but there's definitely a lot that we can learn from today's speakers. So thank you guys for that. If we didn't get to your questions or if you want to keep the conversation going, just keep an eye out for a follow-up email. And we'll also be sharing the recording to today's webinar and then also the resources mentioned today. But you still have time to hop into that Docs tab if you haven't already. But with that, in the meantime, thank you all once more, and we'll see you on the next one. Take care, everyone.
Thank you all.